All right, so we're doing our hamstring strain wrap here on our midfielder in soccer. Unfortunately, she's not going back into play. We've done our horsepower assessment, range of motion's not there, and strength's not above 80%, but we're gonna wrap her up, add some compression. So before we do this, we're gonna ask our athlete if she's ever been taped before. Have you ever been taped before?
Mm-hmm.
Yeah. Any allergies, any tapes or sprays? No allergies. So before, is it okay if I touch you? So we're gonna be working on the affected side. So we're gonna have her in a staggered stance, hip width, shoulder width apart, and putting tone in the hamstring here, using the elevated heel technique. So before I start the tape job, I'm just gonna palpate, and she's gonna say where she's sensitive in that hamstring muscle, so we know where to put our pressure pad. So just tell me whenever it gets a little tender, right there, okay? And then work from proximal to distal, just to find the top edge of the strain here and right here, okay? So right about in the middle of the back of her leg. So before we get taping, she has no allergies, she's been taped before. We're just gonna check PMS. So for this, we're just gonna go around to the front of the leg. Cap refill, good. 1, 2, 3. Can you feel that? Perfect. Can you wiggle your toes for me? All right, awesome. So we've done our PMS. So before we start, we're gonna spray the area down with pre-tape spray. And then we have our pressure pad. So I've palpated to see where the strain is. So our pressure pad is about 1/2 inch diameter bigger all the way around. So that works out perfectly. So to get that to stick to the leg, we are going to use our zinc, and we're going to turn it into double-sided tape by rolling it. I'm going to use 2 strips here. So again, with this, our athlete is not going back into play, but we're just using this to control our swelling and add compression to the area. And again, it's right here, right in the middle of the back of the leg. So we're gonna stick that right to the skin. And then we're gonna apply our tensor band. But before we do that, we're gonna put one more piece of zinc on top of the pressure pad, so our tensor band sticks. Awesome, so now we're gonna use our tensor band, double length, 6 inch, and we're gonna use our herringbone technique, making X's all the way down the front, starting distal on the leg. And we're also gonna use our dog ear technique, overlapping in the first, and avoiding any obstruction on the back of the knee, and keeping in mind our distance with the athlete because we're working kind of in a sensitive area. Up, and then down, up, and then down, and just repeating this. And then down, creating those X's down. Trying to avoid any wrinkles. And then we're gonna lock this in with our zinc tape. Just gonna add 2 strips of zinc to lock this in. Awesome. So now we're gonna add a couple of pressure strips over top to add that extra compression. So whenever I do this, I'm gonna get you to lean into me whenever I apply the pressure strip over top, okay?
Sure.
All right. So I'll let you know whenever you're gonna push back against me with your right leg.
Mm-hmm.
All right, so go ahead. Good, relax. And we're gonna do one more at the top, and go ahead, apply pressure into me. Awesome. So we got a couple of pressure strips there. And we can lock this in with just a little bit of zinc, or a little bit of ultralight, sorry. Awesome. So we're gonna recheck PMS. So you can go ahead and face me now. Go ahead and recheck PMS. 1, 2, 3, good. Can you feel that? Perfect. Can you wiggle your toes for me? All right, so now that she's all taped up again, she's not going back into play. So we're gonna instruct her on police. So we've protected it with the pressure pad and with the tensor band. So I'm gonna tell her to kind of stay off it. No walking, and if she's walking, she can use crutches if she wants to, and I would instruct her on how to use the crutches. Ice. So if you want ice, you can put it on. Make sure to keep it off for 3 times the length that you'd have it on. So if you have it on for 30 minutes, keep it on for an hour and a half, or until the area feels warm. When you put the ice on, you're gonna feel cold burning, aching numbness. Whenever it's numb, take it off. Again, don't put it back on until it's warm, until you have full sensation in that leg. Compression, we've added compression with the compression strips, with the tensor band, and securing it with our ultralight. You're gonna want to elevate it, so when you're sitting at home on the couch or anything, you can prop that foot up 4 to 6 inches. So we'll just put a couple pillows whenever you're laying down. Even when you're sleeping, you can put a couple of pillows underneath your mattress so your foot stays elevated through the night. You're not gonna sleep with this on, so make sure you take it off before you go to bed. You're gonna come back and see me tomorrow, and I'll reassess to see how you're doing.